The profound shift that artificial intelligence is having and will have on the field of medicine cannot be quantified, but what can be measured is one of the most serious issues facing healthcare.
We know that there is a high prevalence of burnout among physicians. Some estimates start at 50%. Even up to 80%. We know that physicians who may be experiencing burnout are more likely to cut back on their hours worked. They may actually leave medicine. And at the end of the day, that means less people to take care of our patients.
If you live in the Boston area, you are waiting an average of more than a month to see a doctor. In 2020, 1/3 of Massachusetts physicians were over the age of 60, a time when the need for doctor retention is at an all-time high.
We went into medicine because of taking care of patients. It's almost impossible to do that if you're focused on typing as fast as you can to keep up with the notes.
Mass General Brigham hospitals are implementing AI to help with those administrative tasks.
With every encounter, every time we see a patient, we want to make sure that we document the details of that, most importantly for the patient's clinical record, so there's a course of what happened and what actions we took, but also there are important legal reasons and billing reasons for us to maintain very careful records. That takes a lot of time. This is where I would say, do I have your permission to record?
Here's how it works. The doctor uses a generative AI application. It records our entire conversation.
What brings you in today?
I'm having a little knee pain.
Any fevers?
Yeah, I do have a slight fever.
I would have had to have typed all of that in either from memory or from my notes and revised them. And here, after the recording, 30 seconds later, I'm able to go to this program on my computer, I find the patient, I click here, and I can see the note. It is absolutely critical that the clinician review every single word here, make sure it's correct, edit it.
The system has the potential to save doctors hours in work, allowing them to spend more time with patients. Can AI predict cancer? It is a question that MIT professor Regina Barzilai pondered while receiving treatment for her own breast cancer.
As a patient, there is a different reality that we don't see. People who go and get radiation every day, and you see them and you really see people suffering. And at that point I thought, I got out and I need to do something to change it.
By change, she meant catching cancer before it becomes detectable to the human eye. She pitched the idea to her own doctors.
When I came and told them that I really want to contribute, they don't need to pay me, I'm just happy to do it. The answer was, we're doing great. We don't need it. We don't need it.
Eventually, she teamed up with fellow scientists at MIT's Artificial Intelligence Lab to create MirEye. It uses an algorithm and a patient's mammogram to predict if a patient will develop breast cancer in the next 5 years.
You could take these sort of standard mammograms.
Barzilai's lab says the technology has an accuracy rate of 75%.
And like a lot of AI, the more information it has, the better it becomes.
A second system, also developed by her team at MIT, Sybil, is designed to do the same with lung cancer, catching cancer patterns long before a radiologist might be able to.
This one was given a negative score.
This image on the right looks clear to the naked eye, but AI picked up a suspicious growth. 2 years later, the patient has visible cancer.
We need to admit to ourselves that our capacity to recognize patterns is very limited.
And Regina Barzilai has now partnered with those once skeptical doctors at Mass General Cancer Center to test the predictive cancer screenings her team has designed, which are not in clinical trial yet.
Well, and one of the problems she talks about with medical AI is that it's so good at spotting patterns that there are very few humans that could actually verify those results. And you don't want to act on those results, she says, until you have a human in the loop. A lot of people are saying the information is good, but you somewhere have to have a human in the loop.
That is key. Still ahead, spotting a fake in the classroom.